4 years ago, my mother had a stroke that completely paralyzed the whole right side of her body. This amazed the doctors because she was only 34 years old, but what surprised them even more was how fast she recovered. She said that she recovered so fast was because she worked with her horse at home. She'd go outside, work on the ground with it, and also ride it. While doing this, she was teaching the horse how to listen to her body language and her cues, but was also reteaching her own body how to perform these maneuvers as well. She called it her therapy time, and it truly was therapy time for her, both physically and mentally. This inspired me to do research to see if therapy in horses is an actual thing, and proves out that it is. It's called therapeutic riding. Therapeutic riding is proving to be more popular and is growing and proving to be beneficial in many different areas, such as that of stroke victims, sexual abuse victims, and autism victims. The first area that therapeutic riding is very beneficial to is that of stroke victims. Park Jung-seo's 2013 article states and discusses how horseback riding is a treatment that focuses on 3 different areas, which is that of the physical therapy side of it, the psychological treatment, and assessment of communication skills. The physical treatment and the psychological treatment aspects of it help correct and improve the posture of the horseback riders, which would be the stroke patients, and also improves their tendons, ligaments, cardiopulmonary system, and their blood circulation. This was proved and tested on 20 adult normal female women who went and they performed these activities and these exercises. The results were outstanding when they had such a significant increase in their muscle strength in their thighs and their midsection, as well as their balance and posture as well. Similar results happened with the chronic stroke patients as well, as they had significant improvements in their muscles in their upper, mid, and lower extremities, as well as their trunk and in their proprioceptive sense, which helps with their balance and their posture and their mobility. The next area that therapeutic riding is beneficial to is that of sexual abuse victims. In Kathleen Kemp's 2014 article, it states that animals have also been known to provide an important emotional bridge to therapeutic alliance, as a difficult to engage child may find it easier to engage with an animal and eventually transfer its alliance to the therapist. They have to learn how to control and how to interact with these large animals that they're not used to. And they also have to learn how to ride them and what different skills they have to use to take care of them as well. A study was done in Kathleen Kemp's 2014 article with 15 adolescents and 15 children that were victims of sexual abuse and neglect. They were assessed in 3 different areas. The first one was prior to intake there, then after the equine counseling, but before the equine program, then after completing the equine program. The results, they had to learn the basic horsemanship skills, such as backing up the horse, getting the horse to move its shoulders and its hips, as well as getting the horse used to scary objects by desensitizing them, and having the horse go around them in a circle on a loose line and jump over obstacles as well. They also, all these skills that they had to do helped them assess different issues they had in their own lives, such as trust, communication, body language, behavior, attitude, and self-perception. By the end of this, all the results finally came down to them having such an improved behavior and improvements in depression as well. The final area that therapeutic riding is beneficial to is that in autism children. A study was done in Sandra Ward's 2013 article on 21 children. They would have a session each day for 10 weeks that would consisted of 4 different parts. It'd be the orientation, the mounting and riding, the riding skills itself, and also the closure. At the end of this 10 weeks, the improvements were drastic in the ways that the children would communicate with others, have their levels of tolerance, and their levels of attention too. This improved a lot. Also, the measures went down from being in the most likely autistic range, dropped down to the possibly autistic range too by the end of the 10 weeks. Beth Landing's 2013 article also talks about how the impact that equine assisted activities has on children with autistic spectrum disorders. They went over and they saw the improvements on the different types of the school functioning they have, the physical functioning the children had, and the social functioning they had as well. Overall, they had a better mental health and behavior in general. The parents were even noticing the improvements in their children as well. Said after they were done riding, they could see the child was calmer and could communicate better and be able to focus more as well. Granted, it was a small sample size of only 21 students, but with more research, we could further conclude and confirm all this information. Further research should also be done in order to help see if other benefits can be associated with the interactions of the horses, besides having a mechanical substitute. All this being said, it is clear to see how therapeutic riding is very beneficial to stroke patients, autistic patients, and sexual abuse victims. As Sir Winston Churchill once said, "There's something about the outside of a horse that is good for the inside of a man."